Hello, thanks for joining us on Infrastructure this week. I am Tina Oje. Following the outbreak of the 2019 novel coronavirus in the world, various countries, in response to containing the effect and continued spread of the virus, were within a short pace of time able to set up emergency medical infrastructure to help combat this global health emergency. Some of the most heartening images of the response to the coronavirus pandemic have come from buildings like the two massive hospitals constructed over 10 days at the epicenter of the outbreak in Wuhan, China, in January and February 2020. States like California and Washington have responded by adapting existing buildings like hotels, including converting an Econo Lodge near Seattle into a coronavirus quarantine facility. Nigeria, with over 200 million people, with an existing weak healthcare system, after recording its first case in February 27, did not ignore the importance of taking proactive measures in setting up emergency health infrastructure to tackle any uprising cases. Today, we shall be assessing how the Federal Capital Territory, which is also among the states with recorded rising cases of COVID-19, have responded through the provision of emergency medical infrastructure to fight the virus. Also, the Acting Executive Secretary, FCT Primary Healthcare Board, Dr. Idayo Iwot, will feature on this episode as we take a look at the state of the primary healthcare system and its role in combating COVID-19. But just before that, let's take a look at some of the infrastructure news in Nigeria and around the world this week. FG asked to convert 6 vacant houses to isolation centers, solicit assistance of estate developers. Senate wants quick completion of Abuja Steel Complex. Ikpazu secures 27.4 billion World Bank funding for Aba Road. On the international scene, new mega subsea cable for Africa announced. Largest solar power project in US to be constructed in Nevada. Details of these stories and more in a moment. In order to effectively manage the rising number of coronavirus cases in Nigeria, Housing Development Advocacy Network has called on the federal government to ensure that seized and vacant houses are converted to Patients Isolation Center. This was made known through a statement signed by the Advocacy Network President, Festus Adebayo, in which he commends the government but advised that more hands must be on deck to tackle the pandemic. One of the effective ways of tackling the pandemic, the statement said, is for the government to make available more facilities for the isolation and treatment of infected persons. It is worthy of note that the federal government, through its anti-corruption agency, EFCC, has seized a number of buildings in major cities of the country belonging to corrupt officials being investigated or prosecuted for looting public funds. Also, there are countless number of buildings abandoned or vacant in most of these cities, especially Abuja and Lagos, usually because they are acquired through illicit means or owned by corrupt officials who already have too many. These buildings, according to Adebayo, can become important facilities for fighting COVID-19 in Nigeria. The Senate has asked the federal government to, as a matter of urgency, expedite action towards the completion of the Abuja Steel Complex. It also appealed to the Ministry of Transport to complete the Abuja-Okaba rail line to facilitate the operations of the Abuja Steel Plant. The resolutions were sequel to the deliberation of a motion titled the Abuja Steel Company, a panacea to the diversification of the Nigerian economy, sponsored by Yakubu Oseni. The Senate's call for the completion of the steel plant is one of many, as both individual and civil groups have, over the years, emphasized the importance for the plant to Nigerians' economy. The Abuja Steel Company in Kogi State was envisaged to serve as a bedrock of Nigerians' industrialization. The Abuja Steel had reached 98% completion as far back as 1994, but not produced a single steel to date after it was abandoned. It has the capacity to become a major producer of industrial machinery, auto electrical spare parts, shipbuilding, railways, and carriages. Abia State Governor Okezie Ikpeazu announced that 5 roads in Aba will be reconstructed to world-class standard after securing international funding for the project. He said a sum of 27.4 billion naira has been secured for the road project following the successful engagement of his administration with World Bank for funds. According to him, the Global Bank released the funds after his administration had paid the required counterpart funding, adding that the people of the state will be very proud of the quality of roads that will be built in the commercial hub of the state. He named the roads to include Ungwa, Orata Road, Port Harcourt Road, Ohanku and Obioha roads, which have been begging for attention over the years, adding that work will commence soon. The Chief Press Secretary to the Governor, Mr. Onyebuchi Ememanka, in a statement made available to journalists in Umuahia, said Ikpeazu broke the cheering news in a live radio program in Aba. The Governor made it clear that every arrangement had been concluded for the commencement of the total reconstruction of the 5 designated roads in a fortnight. A new mega cable capable of carrying extensive data across Africa have been announced. China Mobile International, Facebook, MTN, Global Connect, Orange, Telecom Egypt, Vodafone and WIOCC have announced that they will partner to build 2 Africa. This is expected to be the most comprehensive subsea cable to serve the African continent and Middle East region. The parties have appointed Alcatel Submarine Network to build a cable in a fully funded project that will greatly enhance connectivity across Africa and the Middle East. At 37,000 kilometers long, 2 Africa will be one of the world's largest subsea cable projects and will interconnect Europe eastward via Egypt, the Middle East via Saudi Arabia, and 21 landings in 16 countries in Africa. The system is expected to go live in 2023 and 2024, delivering more than the total combined capacity of all subsea cables serving Africa today, with a design capacity of up to 180 Tbps on key parts of the system. 2 Africa will deliver much-needed internet capacity and reliability across large parts of Africa, supplements the fast-growing capacity demand in the Middle East, and underpin the further growth of 4G, 5G and fixed broadband access for hundreds of millions of people. Ghana's President Nana Akufo-Addo has promised to build 94 new hospitals within a year. Speaking in a televised address, Akufo-Addo said the new medical facilities are planned for 88 districts in Ghana that are currently without a hospital, as well as an additional 6 regional hospitals. The president revealed that each of the hospitals will be a quality standard design 100-bed hospitals with accommodation for doctors, nurses and other health workers. According to him, Ghana needs the new medical center as it doesn't have enough testing and isolation centers to treat COVID-19 patients. Akufo-Addo said that the investment was the largest in Ghana's history. The Department of Interior has approved a proposal to construct and operate the largest solar power project in U.S. history. The Secretary of the Interior, David L. Bernhardt, signed a record of decision for Solar Partners XR and LLC to construct a 690-megawatt photovoltaic solar electric generating facility and ancillary facilities about 30 miles northeast of Las Vegas. The estimated US $1 billion Gemini solar project could be the 8th largest solar power facility in the world when finished and is expected to generate enough electricity to power 260,000 homes in the Las Vegas area and potential energy market in Southern California. According to the Abigail Rose Humper, President and CEO of the Solar Energy Industries Association, despite the challenges of the coronavirus, they're pleased to see that Nevada will soon be home to one of the biggest solar projects in the world. Thanks for watching. The program continues after this break. Do stay with us. Welcome back. If you're just joining now, this is the Infrastructure, where we look at the state of major infrastructure in Nigeria, Africa, and around the world. From the stories making news on infrastructure around the world, we return to the federal capital, Abuja, where the FCT Minister, Malam Mohammed Bello, has demonstrated exemplary leadership in the fight against COVID-19 in the territory. As part of the effort to build emergency infrastructure in the territory to beat the coronavirus pandemic, the FCT Minister inspected the road leading to the Nigerian Center for Disease Control, NCDC Molecular Laboratory.
Access road is critical to the functionality of any place. When the COVID-19 pandemic became a reality in Nigeria earlier this year, the access road to the National Reference Laboratory of the Nigeria Center for Disease Control at Gadwa in the FCT was in a dilapidated state. Consequently, the FCT administration promised to see to it that the road is repaired and upgraded. Barely 3 months after that promise, the road has been completed with solar-powered streetlights all through. Some of the residents of the area who spoke with ASO Radio and Television expressed satisfaction with the present state of the road.
The road, before it looked so bad, it was bush near this NCDC site. And they come clear and they repair the road. The road is looking so good now.
According to the Executive Secretary of the FCDA, Engineer Umar Gambo Jibrin, this is a testimony to the commitment of the FCT administration in its unrelenting fight against the dreaded disease in the territory. Usman Katun Umar, ASO Television News.
According to the World Health Organization, for the COVID-19 war to be won, we need a functional primary healthcare system. While Nigeria is doing relatively well in terms of laboratories, isolation centers, contact tracing, and strengthening of some tertiary health facilities, a critical opportunity is being missed, especially by state government, to incorporate the strongest pillar of every healthcare system, the primary healthcare system, into the fight against COVID-19. Now let's join Dr. Idayo Iwot, the Acting Executive Secretary, FCT Primary Healthcare Board, as he exposes us on the FCT Primary Healthcare preparedness and its critical role in the fight against COVID-19 in the FCT.
Primary health is not a cheap healthcare. It's not healthcare for the villagers. It is a very expensive healthcare, but it is cost effective because it has to do with prevention. It has treatment component. It has rehabilitation component. And when you see that you are doing prevention, you are doing rehabilitation, and you are doing all these works, then it is the most composite, it is the most essential care that will reduce the pressure in the secondary care. So what are we saying here? How far have we fared in the FCT? FCT has not fared very well, though it may be better than so many states. But I want to tell you that we have looked at all these things over time. Ministerial Committee, renovation of primary health care, Ministerial Committee, Administration of Services in primary health care in the FCT, we have done all that. Primary health care has a distinct role. The role is clear. And I want to tell you that the states and FCT have documents that would guide the preparedness and response of the primary health care sector, by extension community sector too, to the COVID-19 outbreak. It is a large document that is being used, and as we are speaking now, we are on the state FCT TOT, that is training of the trainers. We are training directors of primary health care, program officers in FCT primary health care board, directors of primary health care board, and the divisional heads of the FCT primary health care board, and program officers and managers in the area councils. There are 9 participants from each area council, and we have over 15 participants here. They are being trained as facilitators. We are going to train the area councils, heads of the facilities, private and public. And we are going to train the community members too. The World Health Committee chairman, the community mobilizers that we already know, the traditional based attendants, they are all going to be trained on COVID-19 response. And you know that it is very apt now that the community transmission is on. So for active case search, you need the primary health care. What are the symptoms of COVID-19? Catarrh, cough, dry throat. There are simple things people will walk away and they will walk into the primary care facility that I'm having cough, I'm having catarrh, dry cough, and that may be an obvious case of COVID. But that man, because the same symptoms when they start, they just look like ordinary flu. So they will go to primary health care facility before going to secondary care. So the primary health care facility is very critical now. So the preparedness and response has to be optimal. The infection prevention and control, which is part of what we are training people now, should be at the fingertips of the practitioners. And we have to set our primary health care facilities, the arrangement for physical distancing and infection detection should be very high. And that is what the training is all about. It has been for 3 days this year. We'll be for 3 days at the area council level from Monday. We'll be 3 days in the community. So by the time all these people don't come in, what is going to happen? Our primary care facilities are open right now as I speak. We have 247 primary care facilities open right now. And I'm glad to tell you, before the training is over, I've already shared our personal protection wears and hand hygiene and respiratory hygiene materials to some of them. So you have the face mask, the appropriate personal protective equipment have been shared. So we expect that with this going on and the private facilities are open for services, and when the community members are trained and the stigma and all what is associated with these ones are taken care of, then the community search will be optimal and will be able to control the community transmission, which is very desirable, and we must take that lead and working with partners, and particularly key into the emergency operation center for COVID response in FCT, where all of us are members. Is going to be an excellent response in FCT as a whole. Community has been docile, community has been complacent. They don't know that they have a role to play in their own health care activities. They are looking at doctors, nurses, midwives. Everybody alive should be able to take care of himself or herself. So you know the rudiments of the rubrics of health care. You don't need to be a doctor. God has those days to say, have you seen a doctor, have you seen a midwife? You should know what to do to prevent yourself from falling ill, and what to do when you fall ill, and what to do when what you are doing is not good enough, where to go to for further care. If you have not achieved that as you are alive, and you are a resident of FCT, resident of anywhere, you are not started taking care of yourself. So I urge the residents to, the materials are out there. Some of them may be in the social media, they may be misleading. That as we are doing this training, you depend on confirmed sources. NCDC, FCT, EOC, that is the Emergency Operation Center. Those two should be able to give you information that you should use to protect yourself. You know what to do to stay out of problems, not only for COVID-19, but for the prevailing local diseases.
Welcome back. That was Dr. Idayo Iwot, the Acting Executive Secretary, FCT Primary Healthcare Board, exposing us on the FCT Primary Healthcare preparedness and its critical role in the fight against COVID-19 in the FCT. Let's take a break. When we return, it will be time for Infrastructure Watch. Our focus today is on the Idu Train Station Training Center, recently converted to one of the FCT Isolation Center. Do stay with us. The Idu Isolation Center is one of the isolation centers recently constructed for the fight against the COVID-19 pandemic. The facility, which is now open to COVID-19 patients, is a 4-story building which is located at the Idu area of the FCT. The facility used to be an unoccupied training center, which was mainly set up to train local artisans and technicians on how to manage the Nigerian construction industry and provide more talents for the local railway management and operation. To tackle any emergency that might result from the spread of the COVID-19 pandemic in the Federal Capital Territory, the school was modified to suit the purposes of a treatment and isolation center. The most critical thing about the building is that it has a lot of space, as it has 5 floors and many rooms which can accommodate many beds should the need arise. And more importantly, there is constant power supply and adequate water supply. The equipping of the facility was made possible through donations from companies located in Abuja, political figures, and well-meaning residents. The facility has already installed 150 beds, of which 100 beds were donated by Polaris Bank, and Fola Adiola of the Faith Foundation provided 50 beds and other items such as monitors and PPEs. Also, the CCECC provided the furniture, air conditioners and power and water to the facility.
Basically what you are seeing here is a building provided by the Federal Capital Territory Administration to be used as an isolation and treatment center for COVID-19. In the building, CCEC provided the furnishing as well as all the air conditioning, and also is providing the power and the water. And you will see beds. As a matter of fact, we have 150 beds already installed, together with their bed sheets and pillows and also side cabinets. These beds were donated by Polaris Bank, 100 beds. Another 50 were donated by a very important NGO based in Lagos called Faith Foundation. And they have provided 50 beds to us. They have provided personal protective equipment for our medical staff. They have provided monitors that are very critical in monitoring the condition of COVID-19 patients. As a matter of fact, another 300 beds which have been donated by Julius Berger PLC. All this you are seeing here, this private sector initiative, is all done under the Ministerial Advisory Committee of Private Sector Abuja stakeholders under the leadership of former Minister Dr. Modibo Aliyu Umar.
In addition to the already installed 306 beds in the facility, an additional 100 beds and mattresses were donated by Binani Group of Companies. Also, Julius Berger Nigerian PLC donated beds and mattresses, multi-built container offices, and sentry posts to the COVID-19 Abuja Isolation Center in the Federal Capital Territory. President Muhammad Buhari's wife, Aisha Buhari, donated and equipped 100 beds. Abuja Electricity Distribution Company, AEDC, provided electrical fittings and wirings. His stores provided ventilators. Other donations include emergency vehicles, salaries and allowances for staff and health workers. The Green Building also has well-equipped recreation facilities, intensive care units, and staff corners. It is laudable how the private sector in Nigeria has played a leading role in the fight against the coronavirus pandemic through various monetary support and donation of equipment and isolation facilities to support government efforts to win the COVID-19 war. The steep rise in cases, a sign of an ongoing transmission, is a wake-up call for the creation of more isolation centers, molecular laboratories, ventilators, and provision of PPEs for health workers in the front line to help cap the spread and bring an end to this global health pandemic. It is also pertinent for every Nigerian to be a part of this fight by maintaining social distancing and all rules and regulations set up by the federal and state government as well as the Nigerian Center for Disease Control to stop the spread and bring an end to this global health pandemic. Moving on, we now bring you a special feature on FCT isolation and treatment centers for COVID-19.
The emergence and global spread of COVID-19 poses a significant threat to the public health globally, especially for health system in low and middle income countries. Since the first case was reported in Nigeria on 27 February 2020, the rise in the number of cases has been exponential. The first set of the COVID-19 cases recorded have been among travelers returning to Nigeria from COVID-19 highly hit countries. The federal government restricted flights from high-risk countries into the nation's airport and later followed with total closure. To avoid community spread of the virus, President Muhammadu Buhari directed weeks of lockdown of Lagos, Ogun, and the FCT. In handling the COVID-19 pandemic, new laboratories have been established and others upgraded in different states by the Nigeria Center for Disease Control (NCDC) to carry out testing on samples of individuals suspected to be having the disease. To boost the number of daily testing in the country, the NCDC introduced the COBAS system, in which approximately 960 samples can be tested in 8 hours. The country now has the capacity to do a minimum of over 3,000 tests daily. In addition, thousands of health workers are being trained by the NCDC on infection prevention and management as it relates to COVID-19. However, the NCDC is continuing working in collaboration with states and private firms in setting up more laboratories in order to increase testing and tracking of COVID-19 cases in the country. To handle the surge in the COVID-19 cases in the FCT, the Federal Capital Territory Administration has been able to convert and upgrade several hospitals to isolation and treatment facilities for COVID-19 patients, among which are the University of Abuja Teaching Hospital, Gwagwalada, the National Hospital, the Zuba General Hospital, Asokoro General Hospital, Karu Hospital, as well as the Idu Train Station Training Center. The Minister of the Federal Capital Territory Administration, Malam Mohammed Musa Bello, spoke about the medical infrastructure in the FCT.
FCT administration approved that Asokoro District Hospital will be used as an isolation and treatment center. And I'm very delighted with this choice because the medical personnel themselves sat down and decided that this should be the place. And we all know that over the last few years, this particular facility has been known to be a center of excellence. Why this facility here is very crucial is that in addition to the normal treatment, it has facilities also for intensive care, where those, and from what we know, usually there are a very limited percentage that might need intensive care, and we are working towards that.
The latest on the list of private initiatives to fight the coronavirus pandemic is This Day Dome, COVID-19 Testing, Tracing and Treatment Center. The 300-bed facility with a 54-gene laboratory is a private sector-driven initiative donated by a consortium of like-minded partners powered by the Sahara Energy Group and the This Day Media and Technology Group. Other partners on the project are the Coalition Against COVID-19, CAR-COVID, the African Finance Corporation AFC, China Civil Engineering Construction Corporation CCECC, Nigerian National Petroleum Corporation NNPC, and the Central Bank of Nigeria CBN, among others. Considering the level of preparedness of the FCT administration in tackling the COVID-19 pandemic, what is left is for citizens in the Federal Capital Territory to take full responsibility for their actions.
Thanks for sticking with me throughout the program. Do stay safe and observe all the precautionary measures to prevent yourself and family from contacting this COVID-19 virus. Let's stop the spread, take responsibility and stay safe. And together, we can overcome this. Please join me again next week. I am Tina Oje.